Welcome. I'm feeling very alone here tonight. Chris couldn't make it, so I have to do his work as well. Unfortunately, our snacks arrived a little bit late, so people are still grabbing a few bites. But you can come in. Those that can hear me outside, you can finish your little snack inside. Who's here for the first time tonight? Welcome. You are very welcome. We're glad you're here. And we believe that you're going to learn a lot. So last night's lecture was on hormonal health. So this is a little revision. Have you received your papers? Okay, so let's just see. Okay, Alice is handing out some papers. Just put up your hand if you haven't received the little paper yet. There's a few on this side, Alice. So let's just make sure everybody gets. While we're waiting, if you need the toilet, it's just out here and down the passage. There's also a children's program. There's a children's program that's running in the room next door. Some of you have benefited from the chair massages. And if you would like to have a chair massage, you can come directly after the lecture. We'll be there at the back. So you can have a few-minute chair massage. And then our next lecture is on Sunday evening at 6:30. So we're going to have a break for the next few days and then Sunday evening. All right, I'm going to start so long. Seminar 3, Hormonal Health. Our hormonal system is arranged in a hierarchical fashion. Hormones are secreted from several glands in the body into the bloodstream, where they are transported to and exert their effect on the endocrine glands and cells all over the body. The major endocrine glands are, let's see if we can remember a few. Okay, there's the thyroid, adrenals, the pineal gland, the parathyroids, the pituitary, adrenals, and the pancreas. And then also the ovaries and the testes. So those are some of the main glands in the body. Healthy hormonal levels fundamentally affect our overall health and how we age. We need to choose lifestyles that keep our hormone levels balanced at youthful levels for as long as possible. 3 endocrine glands that are really important to consider as a departure point include, which ones? The adrenals, remember? And the thyroid and the pancreas. So those are 3. Adrenals, thyroid, and pancreas. When we assess and correct hormones, it makes sense to do so in ascending hierarchical fashion, as hormones at the base of the hierarchy can often affect the function of apex hormones. So the ones at the bottom can affect the function of the ones at the top. We need to choose lifestyles that keep our insulin low, i.e. maintaining good insulin sensitivity, keep our adrenals in balance, and that enable our thyroid glands to function well as a start. To do so, we must identify and really appropriately deal with stress. I see Dr. Bruce was a bit stressed today when he typed this paper. He left a few words out, but I'm sure you're gonna catch on. Okay. Identify and stop ongoing protracted inflammation, detoxify the body, and minimize as far as possible toxic input. Ensure adequate nutrient intake and exercise, and get appropriate rest. So that paragraph is very important. That one is important, because that's what we can do, isn't it? Something that we can do. Thyroid function is often incompletely assessed by many healthcare practitioners. If one's thyroid gland is not functioning well, start with lifestyle assessment and modification where indicated. A thorough assessment would include a TSH, an FT4, FT3, and thyroid antibodies, guided by whether the gland is over or under functioning. Now, I had a little talk to Dr. Bruce this morning, and I said what we need is like a sheet with the meaning of all these, names and figures and symbols. I think it will help us. What do you say? I think it will help us, eh? So, Dr. Bruce, next week we need it so that we can understand what this is all about. Our bodies were designed to heal. Given the right environment, they most often do so. The art and skill of good medicine is trying to provide that environment. This is also key. So if the environment is right, then the healing will take place, usually naturally. A sensible question one must always ask is there something I must add or something I must remove to allow healing? Is there something in my life that I need to add? For instance, like exercise? Is there something that I must remove? Maybe some unhealthy things that I'm eating or drinking. Let's cut that out and maybe add some sleep, add some fresh air, some sunshine. They're all here behind me. Water, and you'll see the change starting to take place. Where needed, a practitioner skilled in dealing with bioidentical hormone replacement and therapy can help in achieving balance in your hormonal system. So this is yours to take home, and we're looking forward to tonight's lecture. Before Dr. Bruce speaks, for those who have just arrived, Dr. Bruce studied optometry, and then he went into medicine and studied medicine. So he's a doctor who can help you to see your health better. He's got that ability. So he has worked in various places in the world, New Zealand and Ireland and England and Australia and South Africa, different places in our country. So it's wonderful to have you in Westville tonight. And Dr. Bruce, we look forward to hearing tonight's lecture. It's about the heart. Thank you.
Hello everyone, good to be back with you. Just a few apologies to start with. First one about the technical terms last night. I've heard a few comments about that and I want to apologize for that. Sometimes I get excited and carried away, and obviously these things, when you talk about them all the time, you get used to the language. It wasn't my intention to confuse anybody. I'm happy to clarify anything that needs clarification. Second one, for my rough appearance. I had everything when I left home today, but I forgot my shaver, so my apologies. That wasn't my intention. So tonight's lecture is extremely important, and I'm glad you've come. I don't think it's an overstatement to say, firstly, I just want to back up a little bit to what was said in that, what I was trying to bring out in that little summary sheet. I'm really passionate about the fact that our bodies were designed to heal. And in my opinion, based on where I'm at in my career at this stage, I think a doctor is someone who should understand physiology so well that they can know how to modify the environment to allow that healing to happen. That's the art and practice of good medicine, is to lock into the innate healing potential of the body. Your body was made with an incredible capacity to heal, given the right environment. The problem today is that our environments have become so spoiled in terms of our diets, our stress, our sleeping patterns, that we've lost a lot of that innate healing capacity. So that's a fundamental premise of what I'm trying to share with you in these meetings, is that you have the capacity inside of you. It's not some ethereal concept. It's an immune system-driven mechanism to heal. And so if you're not healthy, and where we're not healthy, we need to say, well, what are the barriers to health? And that's what we're trying to look at. So again, the fundamental premise is, to be healthy, we need to understand what makes us sick. Okay. So tonight's lecture is really, I believe, if we start to understand the mechanisms of cardiovascular disease, this information, if you apply it, can literally save your life. Quite literally, without overstating it at all. You know, cardiovascular disease is one of the leading causes of death in the first world. You know that. So people are dropping dead because of heart attacks and strokes. Isn't that the case? So why is that happening? And that's what we want to look at tonight. So let's get that started. That's what it's all about. I'll apologize in advance. Some of my slides are a little busy. You don't have to look at all the information necessarily. I've tried to highlight some of the key points. When I get more time, I always edit and modify as I go along. So for those that are busy, I apologize, and I'll try and clarify some of those. So the heart sits in the thoracic cavity, in the center of your chest. For most of us, the left ventricle goes to the left side of our chest. You get a condition called Dextrocardia, where it flips over to the other side. What am I showing in this X-ray? Anybody know? What's this? That's actually an X-ray of an abdominal aneurysm. An aneurysm is a dilation of the blood vessel. And that is calcification in the blood vessel wall. And one of the big problems that we're facing today is that we're getting calcium depositing where it doesn't belong. And one of the places calcium is sitting is in your blood vessels. So if I take an X-ray of your stomach and I see calcification lining your aorta, that's a bad prognostic sign. It goes hand in hand with atherosclerotic cardiovascular disease. Calcium is sitting often on the atheromatous plaque that's putting you at risk of heart attacks and strokes. So we want calcium not to be sitting in our blood vessels. We want it to be sitting where? Calcium belongs in the bones. And there's a reason that it's sitting there. And one of the things you must remember for tonight is vitamin K2 is very important in cardiovascular health. Vitamin K2 helps to get the calcium out of the arteries and into your bones. It's one of the things that, and it does that by, we'll get to it just now, I won't digress just yet. So we don't want calcium sitting in our arteries. Our arteries are designed to be elastic. So we said we burn up, we swell up, we dry out, and we turn to stone if we don't look after our health. That turning to stone is we calcify. We get calcium depositing in the wrong places, like in our blood vessels, which are designed to be elastic and to be expanding and contracting. Okay, so let's look at the heart. The heart has got how many chambers? Keep you awake tonight again? 4 chambers. So what's this side? That's the left ventricle, that's the right ventricle. So essentially you've got 2 hearts that are joined in one. You've got a right heart and a left heart. And the right heart pumps to the lungs. And the lungs pump it back via the pulmonary veins to the left heart, which pumps it to the body. So the right heart's pumping to the lungs for oxygen, gets the oxygen in the lungs, comes back into the left atrium, left ventricle, and out through the aorta to the rest of the body. So, what makes an athlete have a good resting heart rate? When you exercise and you engage in aerobic activity, you strengthen the ventricle. You'll see that the muscle on the left side of the heart is a lot thicker than the right side of the heart. So the left side is a high-pressure system. It has to generate a lot of pressure to get the blood. Basically, those of you that have done physics will know that the thing that causes flow is what? A pressure differential, isn't it? So for something to flow, you need to have a pressure gradient. So the heart is working. The reason it's pumping is it's creating a pressure gradient. This muscle contracts forcibly, forcing that blood through the aortic valve, which has got 3 valves, and into the thoracic aorta. Takes a bend, goes off to the head, well, those 3, and then down, curves down at the back, through the rest of the thorax and into the abdomen and to your legs. So that goes up to your head by the carotids, brachiocephalics, and all of those. That goes down to the stomach and into your legs. So the left heart is generating a pressure gradient to shove that blood into the rest of your system. Whereas the pulmonary circulation, the lungs, is a low-pressure system. It doesn't need a very strong heart to pump to a low-pressure system. So the right heart is a lot smaller in terms of its muscle thickness than the left heart. Does that make sense? So an athlete gets, if you measure an athlete's heart rate, you'll often find that he's sitting in 40, 50, and yours might be 72. Why is that? Because of training, his left heart has become thickened. It's like doing a bicep curl. If you constantly do a bicep curl, you're going to strengthen your bicep. And it's the same thing with the heart. When you've been exercising it, you strengthen the left ventricle. So that for each contraction, it's pumping more blood for each unit contraction than somebody that's less fit might be. So his cardiac output, which is the amount of blood that your heart is pumping in a given unit of time, is a product of your heart rate and your stroke volume. So when the heart pumps, and the stroke volume is defined as the amount of fluid that moves out with one pump, and then some of it, when it pumps, falls back. So the amount of blood that's leaving with each contraction is determined by the strength of your muscle. So if you now have a heart attack, remember a heart attack is often kills off some of the muscle in wherever the heart attack is. Your heart can't pump that effectively. So we call it ischemic heart disease, which we're going to look at today. Can be one of the causes of your heart not functioning properly, and you can get cardiac failure. That's just to give you an overview. So an athlete, by strengthening his stroke volume, can keep his heart rate lower and still get the same cardiac output by a relationship with that equation, just to tell you how some of the stuff works. Interesting, isn't it? So this is the structure of a vessel. The inner lining of a blood vessel consists of a number of specialized cells called the endothelium. An artery, actually any vessel, has 3 layers to it: a tunica intima, a tunica media, and a tunica adventitia. So 3 layers to blood vessels. The inner lining is what's really important in your cardiovascular health. A lot of it is, but the thing that's the first barrier defense. Remember we talked about barriers in the gut? You've got a barrier in your cardiovascular system. And that's these endothelial cells. And these endothelial cells are what you have to keep healthy if you want to be cardiovascularly healthy. In fact, it's been said that your health is determined more by the health of your endothelium than any other single factor. That's quite profound, isn't it? And previously, this is what's happening. So once you get out of that thoracic aorta into the abdominal aorta, you get the arteries coming off as the divisions and trunks of that aorta, which is supplying the oxygenated blood to the body. And then it breaks down. So that's an artery. It becomes a smaller thing called an arteriole. That breaks down into capillaries and then become venules and go back to the heart for oxygenation. So the capillaries are diffusing the carbon dioxide and oxygen at the tissue level. And then once the wastes and everything are back in there and the oxygen's been taken off, it's got to go back to the heart to get oxygen again. And you've got this circuit happening. So there are approximately 100,000 kilometers of blood vessels in your body. 100,000 kilometers, 60,000 miles roughly. So once considered inert, the endothelium, we're talking about that inner lining of your blood vessels, is now considered the single largest secreting organ in the body. We thought previously it was just a passive structure that would contract and expand. But actually it's been found to release a substance called nitric oxide. Many of you will have heard of nitric oxide. It's a 2-atom gas, which is now considered the hallmark of normal endothelial function. So a healthy lining of your blood vessel produces healthy levels of nitric oxide. Nitric oxide is produced from an amino acid called arginine. So foods that are rich in L-arginine have the potential to affect your cardiovascular health favorably. And there are a lot of vegetarian foods that actually are high in arginine. We'll look at some of those. So arginine produces nitric oxide. Nitric oxide is a vasodilator. It has these benefits. It affects vascular tone, inflammation, coagulation, and oxidation. So just to give you the overview. So your cardiovascular health is largely dependent on the health of your endothelium. So if you want a healthy cardiovascular system, you need to be living a lifestyle that protects the integrity of your endothelium. Does that make sense? So we need to look at what protects the endothelium and those things that damage the endothelium. So conditions that have been linked to endothelial dysfunction: diabetes, atherosclerosis, heart disease, hypertension, multiple sclerosis, lupus, scleroderma, rheumatoid arthritis, ALS, Parkinson's, hypercoagulation, renal failure, metabolic syndrome, sleep apnea, glaucoma. So a wide array of conditions have been associated with endothelial dysfunction. Now we've got to find out, well, what's damaging our endothelium? That's what we've got to find out. These are some of the factors that affect the health of your endothelium. Does everybody understand what I mean when I say endothelium now? So just don't use the wrong terms. So endothelium is the lining of that blood vessel, things that damage it. Oxidative stress. When we breathe, we get oxygen into our cells, but we're metabolizing in this fire, this metabolic fire. And the downside of that is that produces free radicals. Free radicals are oxygen species which have become unstable. They've lost some of the electrons, and they're a bit reactive. And they can cause further damage. They try and balance the electrons they've lost by taking them from your tissues, for instance. And we normally endogenously produce some antioxidants to neutralize those free radicals, and our diets were designed to neutralize free radicals. So what sorts out free radicals? Antioxidants. So where do you find antioxidants? Fruit and veg, largely. So plant-based foods are high in antioxidants. So normally just breathing, me standing here breathing, I'm generating free radicals. But depending on what I had for lunch or breakfast or supper tonight, the body tries to maintain a balance between my antioxidant status and my free radical damage. So oxidative stress is one of the things that is targeting those cells. It's damaging those cells because it's robbing them of their stability. Bad fats, hydrogenated fats. You don't want artificially manipulated fats. You want healthy fats. The healthy fats are olive oil, coconut oil, and sorry, what is the other one? Coconut, olive, and third one escapes me. Olive, it'll come to me now. Olive, coconut, and it'll come. Stress. Cortisol damages your endothelium. So if you're under constant stress, that's another factor that destroys the lining of your blood vessel. Insufficient or obstructed sleep damages your endothelium. Chronic bacterial infections. Now this is the buzzword. There's buzzwords in medicine. Buzzword of 21st century medicine is inflammation. Protracted, unremitting, chronic, untreated inflammation is precipitating cardiovascular damage. And we're going to look at that tonight. Low vitamin D levels affects your endothelial health. Low vitamin B12. Anybody heard of homocysteine? Okay, homocysteine, you might remember that really complex cycle I showed you last night. That's your methylation cycle. So as part of that cycle, from methionine, once SAMEs come off, you get a product formed called homocysteine. Homocysteine is an amino acid, but the analogy's been made that it's a bit like taking barbed wire and pulling it along the vascular endothelium. It has this kind of destroying effect on the tunica intima. So you want to make sure your homocysteine is adequately at a good, healthy level. And ideally, you want your homocysteine at least to be less than 6.1. If time allows, and if you're interested, I can give you a set of biomarkers that you should be asking for at a lab to know where your health status is at. And one of those is homocysteine. A fasting homocysteine sent on ice is a useful thing to know in terms of your cardiovascular risk. It's been associated with cardiovascular disease. The association has been questioned, but it's one of those things that you want to keep in optimal levels. But yes, it's almost like taking barbed wire across your blood vessels. That's been the analogy. It's been linked to things like dementia as well. So if you've got dementia in your family, you want to know what your homocysteine level is doing. Hyperglycemia. So when your blood sugar gets out of control, and we're going to look quite a bit at that tonight, every time your blood sugar spikes, you're actually causing damage to your blood vessels. So you want excellent glycemic control. Euglycemia is what you want to maintain. When you must choose a lifestyle that optimizes how your body processes glucose. If there's a massive disparity between your glucose and your insulin because you're resistant, like we were talking about last night, we're going to see that tonight. You dramatically increase your cardiovascular risk, you dramatically increase your cancer risk. So we need to be living lifestyles that keeps our insulin nice and low. That's very important. Sedentary lifestyle, especially lack of cardiovascular exercise. Now, actually this is a balance like anything else in health. If you want to stay cardiovascularly healthy from an exercise perspective, if you over-exercise and you're constantly breathing and you exceed all your antioxidant capacity, you're actually doing damage to yourself. So moderate cardiovascular exercise is good for you. Excessive, severe, extreme exercise is actually not good for you because you're generating a massive free radical stress. And like we were talking about in the first night, controlling and regulating your breathing through nasal breathing is one of the good ways to regulate your volume and flow. But you don't want to do anything out of balance, so you want moderate intensity exercise. Okay. So how do we restore endothelial health? This is the question we must answer in looking at our cardiovascular risk. You want to engage in, as I said, daily moderate exercise. You're going to see that no matter what we're talking about, there's certain lifestyle factors that just come up. And that's nice because when you subdivide health into separate systems, you can easily get the idea that there's 70,000 things you have to do. But it's actually not like that. You'll find that the common denominators are all the same. Daily moderate exercise is going to come up all the time. Stress reduction reduces cortisol-induced damage. Optimize your liver function. You know milk thistle? It's been shown to protect the endothelium. Milk thistle has been scientifically proven to benefit and regenerate your liver. So milk thistle is very good to help your liver cope. Optimize your vitamin D. As we said, laugh. Look at this. A study showed that healthy men and women who were shown a funny movie increased blood flow by 22% and improved vascular and endothelial health. The effects of laughter lasted for 45 minutes after the movie had finished. So how much laughter is in your life? We don't laugh enough. Yeah, that's important. So antioxidants, we said, minimize the damage free radicals caused to the endothelium. Vitamin A and carotenoids are found in carrots, squash, broccoli, sweet potatoes, tomatoes, kale, collards, all those. Vitamin A is important. Vitamin C, vitamin E, these are the antioxidants, right? Flavonoids, quercetin. Quercetin is a compound that has good anti-inflammatory properties. It's found in, where do you find quercetin? Sorry? You may do, I'm not familiar, but it's certainly high in onions. So the red onions are quite high in quercetin. It's a good anti-inflammatory compound. Healthy fats, that's it, avocado, coconut, and olive oil. So those, if you want to focus on 3 healthy fats, avocado, olive, and coconut, those are really healthy fats, and we'll see a bit later that they favorably affect your blood lipid profile, which is great. Magnesium, zinc, and calcium help to preserve endothelial health. And healthy proteins, nuts and legumes have L-arginine, that's what I was talking about. So in nuts and legumes you find the amino acid arginine, which helps your vascular endothelium to produce nitric oxide. So basically, healthy endothelium produces good levels of nitric oxide, sick endothelium doesn't. And that's fairly simple. And then antithrombotic and anti-inflammatory herbs can be helpful. Curcumin, ginkgo, and garlic are shown to decrease inflammation, regulate blood viscosity, preventing hypercoagulation. Proteolytic enzymes, those are enzymes which break down proteins, such as serrapeptidase and nattokinase, or enzymes which reduce inflammation. Bromelain, found in pineapple, one of the best anti-inflammatory substances known. What common denominator are you seeing with all these slides? Where are these substances found? They're found in a beefsteak. They're not. They're found in plants. If you wanted the best chance, and we'll look at that lecture on Sunday, you want the best chance to provide the raw materials your body needs to heal, it's found in the plants. So I grew up hating Brussels sprouts. I still don't like Brussels sprouts, but I can fight that as much as I like. The good stuff is in there. We must learn to like the things that are good for us. And often we don't like things because we've been eating chocolate for 40 years, and then Brussels sprouts doesn't taste too good. I mean, it just doesn't. So we need to educate ourselves to enjoy the things that are good. And if you want health, you need to be willing to take that step. So I'm one of those people that are now, if something tastes like mowed lawn, but it's really good for me, I might try it. Not that I want it to taste like mowed lawn, but if it's good for you, you must decide what you want. And the thing is, as I said, it's about educating your palate to enjoy the good things. So, meal balancing is important when it comes to looking after your cardiovascular system. You want to eat balanced meals that have healthy plant-based fats, healthy plant-based carbohydrates, healthy plant-based proteins. So meal balancing is important. Avoid white flour and sugar. That's non-food. White flour and sugar is not food. So when you go to Mug and Bean, I mustn't say names, I suppose, but you see those lovely muffins like I saw today when I went to lunch. I love those muffins. But that's refined flour, refined sugar. It's cardiovascular nightmare. That's what it is. So, and the more we eat that kind of food, the more we have to eat that kind of food because it's addictive. You must remember that the food industry is not out to preserve your health. They're there to keep you coming back to make money. And so, foods that we keep saying yes to are foods we're often addicted to. Things that keep us addicted to foods are sugar, salt, and fat. The sugar, salt, and fat content of a given food keeps us coming back for more. And these white flour and sugary foods are the reasons our middles are expanding, the reasons we're getting insulin resistance, the reason we're getting cardiovascular disease. So eat a high-fiber foods, ideally 50 grams per day. Beans, whole grains, vegetables, nuts, seeds, and fruit all contain beneficial fiber. Avoid all processed junk food. Question you must ask, we said, is this food? Is what I'm about to eat food? Simple question. And food, by definition, is something that gives my body more than it takes, and something that keeps me in balance. If it's going to cause imbalance, then it's not food. Increase omega-3 fats, eliminate all hydrogenated fat. Hydrogenated fat is a manipulated fat. It's a man-processed fat, such as margarine, shortening, processed oils, as well as many baked goods and processed foods. Use healthy oils such as olive oil, extra virgin olive oil, cold-pressed sesame, other nut oils, and we said coconut and avocados. Avocados are superfoods. If you want to make me happy, bring me a box of avos. Avocados are superfoods. And there's certain foods that meet the definition of superfoods. Sprouts, avocados. I'll try and think of it as you go along, but you can't. Avocados actually favorably affect your blood lipid profile. It's such good food. It's a very complete food ever. Try not to eat 3 hours before bed. Avoid alcohol. Alcohols affect your blood lipid profile. It increases your triglycerides, which is an independent cardiovascular risk factor. Fat in the liver and create blood sugar imbalances. Use soy foods such as soy milk, edamame, soy nuts, tempeh, and tofu, which can actually help lower cholesterol by 10%. Legumes, like soybeans, are fantastic foods, absolutely fantastic foods. They come with protein, fiber, everything in one. So if you want a complete food, get into legumes. And there's so many legumes you can get now. Peas and beans, yes, absolutely. So the legumes are all the peas, beans, those kind of foods. They're full of fiber, full of protein, full of the right kind of carbohydrates. We'll take questions at the end, if that's all right. Thank you. Eat at least 8 to 10 servings of colorful fruits and veg. These are things we can do to help our vascular endothelium, right? Which contain disease-fighting vitamins, minerals, fiber, phytonutrients, antioxidants, anti-inflammatory molecules. So, again, a plant-based diet. 30 to 45 minutes of cardiovascular exercise 6 times a week. Try interval training if you're feeling stronger. Interval training is where you push yourself and then stop, and push yourself and then stop, and that favorably affects your metabolism and your mitochondria. We're going to look at metabolism a bit later in one of the lectures. Strength training builds muscle and reduces body fat composition. Remember we said yesterday that one of the more important factors to consider is how much of my body is fat, how much of your body is fat. And we need to get our bodies to the place where we're in the optimal fat percentage range for our age, height, and weight. Or age and height, rather. Exercise is a necessity, not a luxury. Exercise is a necessity, not a luxury. And I struggle with this like anybody else to get going. But I mean, once you get into a program, as we said, there's certain lifestyle changes that have a massive knock-on effect on many things. Nutrition is one of them. Exercise is the second one. Exercise should be seen as important as eating. You don't decide whether you're going to eat or not. If you eat. And exercise is actually, we're made to move. We're made to use our muscles. We're made to use our cardiovascular system. And one of the things that's really making us sick, metabolically and physiologically, is inactivity. We're not made to sit. We're not made to be couch potatoes. It's preventing in almost all chronic disease, from heart disease to cancer, from dementia to diabetes, osteoporosis to osteoarthritis. You cannot age successfully without exercise. Profound, eh? It's how we are designed. Stress creates inflammation, raising your cholesterol and blood sugar, causes high blood pressure and makes your blood more likely to clot. A study compared, the statin drugs. Everybody know the statin drugs? So statins are one of the most prescribed medications for cardiovascular disease, to try and bring your cholesterol into a favorable profile, which we're going to look at. But compared statin treatment to a diet high in viscous fiber, almonds, soy, and plant sterols, and found that they were equal, although the diet was more effective in lowering inflammation than homocysteine. So, remember, most of our medical conditions are not drug deficiencies. They're not drug deficiencies. So, what's the pathophysiology? Pathophysiology means how does the disease process develop? That's what pathophysiology means. So how do we get sick at a cardiovascular level? What happens preceding a heart attack? If you know this and you apply it, you can dramatically decrease your likelihood of dying by cardiovascular disease. Vascular inflammation has emerged as a critical and established component of atherosclerosis. So atherosclerosis is the process which I'm going to show you in a picture now, where the body progressively deposits fat along your artery wall. That's atherosclerosis. They're finding that inflammation in the vessel wall is a critical and established component of atherosclerosis genesis, which is starting, activity, and potential plaque instability. Patients with established coronary artery disease who possess a confluence of risk factors known as the Metabolic Syndrome remain at particularly high risk for a future vascular event, such as an acute MI or CVA. That's a stroke, cerebrovascular event. So if you have the Metabolic Syndrome, which is what we were talking about yesterday, It's actually been shown that 42% of cardiovascular risk is associated with your insulin regulation. 42%. Biochemical markers such as elevated levels of highly sensitive CRP in the absence of systemic inflammation are thought to signal an increased likelihood of vascular inflammation to portend a higher risk of vascular events. This marker may also signal more rapidly advancing coronary artery disease and the need for progressive preventive measures. All that's saying is, the more inflamed you are, the more inflammation you've got churning on in your system, the greater your cardiovascular risk. So one of the other markers you need to be aware of, in addition to homocysteine is one of them. The next one you need to know is a highly sensitive CRP. Because that tells me, that tells us, that tells you, what is this amount of inflammation happening in your body? And then you've got to think, well, what are the causes of that? Because that inflammation is dramatically increasing your risk of dying of heart disease. Inflammation is killing you. So this is how it develops. This process, unfortunately, starts in early adolescence, and if not earlier. We started to deposit fatty streaks. And the theory of this is that damage to the endothelium is often the initiating insult that is causing this atherosclerotic process to start and progress. So it's, in a sense, it's almost like the body's using cholesterol to patch the damage we're causing to our endothelium. Does that make sense? So there's an endothelial insult. There's something that's damaging my inner lining of my blood vessel. The body's using cholesterol to patch that insult, and that patching progresses over time to form these atheromatous plaques, which then get swallowed up by things like macrophages, which are part of the immune system. They form a thing called foam cells. There's inflammatory cytokines involved. Then you get inflammation involved in this, and there's a little cap. This forms often a calcified cap that is called the shoulder that faces the vascular lumen. Well, that's the point that often is weak and vulnerable and can rupture. When that plaque ruptures, it releases thrombotic mediators, or things that tend to cause clotting. And so you get platelets coming along, and they adhere to that ruptured plaque, and they cause a variable degree of occlusion of if this is your coronary artery. Remember, the coronary arteries supply the heart. So if this is happening in your coronary artery, you get a plaque rupture from this fatty plaque. The platelets come along, and they do what platelets do best, which is to form a clot. They form a clot on this ruptured plaque, cause a variable occlusion of your coronary artery, and then the heart muscle that's supplied by that coronary artery dies. And that's what a heart attack is. That's called a myocardial infarction. So the initiating event, and if that's supplying a major portion of your cardiac muscle, your heart muscle, you can die instantaneously because you're no longer pumping your heart. So, and often it's associated with arrhythmias like ventricular fibrillation, because you've caused an arrhythmia consequent to this ischemic insult or this inadequate blood supply. So that's what's happening. So why is this happening? So we're saying there's something that's damaging our endothelium. That's one of the theories, that this endothelial insult, which the body's patching up, you're getting inflammation, calcification, a plaque forming, inflammation on top of that. So coronary artery disease is a chronic inflammatory condition. Does that make sense? So you get this plaque that's forming, you get inflammation that's waxing and waning on it, and then at some stage, if you're really unlucky and if you haven't controlled the factors adequately, that plaque ruptures, get a variable degree of occlusion, and you get what we call acute coronary syndrome. So acute coronary syndrome encompasses a full-blown heart attack, where you get characteristic ECG changes. It also encompasses things like technical, non-STEMI, and unstable angina. But basically, variable degree of occlusion of your vessels with consequent damage, in some cases, to the heart muscle. Does that make sense? So you want to prevent that process. You need to know what's causing this. So I'm going to focus a lot on insulin resistant, because we'll see some very interesting factors that we used to think that fat causes atherosclerosis. Atherosclerosis causes heart attacks. Therefore, fat intake causes heart attacks. That's how we used to think, and that was a theory that started in the mid, I think 1950s or so. But we found that it's actually not that simple. It's not just a simple matter of I eat fat, therefore I'm going to get a heart attack. It is important to know your lipid profile. It is important to control your lipid profile within healthy parameters. But that is not the only factor causing heart attacks. And they found that 50% of people that have heart attacks actually have normal cholesterol. 50%, 1 in 2. They also found an interesting thing they also found was that if you control, you know the different types of fats you get in your blood? You get HDL, LDL, triglycerides, VLDL, very low density lipoprotein. So there's different sizes and types of fats that constitute the lipid profile. That different ways that the body transports cholesterol and deals with it, essentially. They found that if you control your LDL cholesterol, which is traditionally considered to be the bad cholesterol, that's taking cholesterol and depositing on the wall, right? That's the LDL that does that. HDL is the good cholesterol, which takes it from the vessel wall to the liver, essentially. If you control your LDL 100% optimally for the course of your life, you only prevent 16% of heart attacks. So that's telling us it's not just about fat. And we must get that message. So we've been focusing, heart disease prevention and treatment has been largely focusing on controlling your cholesterol. And that is important. But what's been realized now in cardiovascular prevention strategies is that you need to be aware of the contribution that chronic unremitting inflammation is having. So you've got the vascular insult, you've got the fat deposition, but now you've got the inflammation that's happening on that milieu that's actually rapidly progressing your cardiovascular risk. Does that make sense? So, if you look at this, we spoke a bit about insulin resistance. Excess diet, sedentary lifestyle, genetics affect how our bodies end up processing carbohydrate. When we become insulin resistant to our own insulin, we produce more insulin to try and overcome the blockage. That high insulin level is increasing your cardiovascular risk. It increases endothelial dysfunction, increases dyslipidemia, which is unfavorably affecting your lipid profile, makes your blood more likely to clot, increases inflammation. Insulin is a pro-inflammatory hormone. It accelerates inflammation in your body. So you want to keep insulin low, increase atherosclerosis. So we'll get back to that. Coronary artery calcium. The presence of calcium in coronary arteries is almost always indicative of atherosclerotic plaque, but bears no relation to plaque stability or instability. Cardiac risk factors and insulin resistance lead to progression of coronary artery calcification. So what are cardiac risk factors? What are the things that, lifestyle-wise, or what medical conditions put you at increased cardiovascular risk? Can you name some? Blood pressure. Blood pressure affects your damages your blood vessels. High blood sugar, we said. Free radicals. Family history. Unfavorable lipid profiles. These are some of the things that can affect your cardiovascular risk. Plus, insulin resistance leads to progression of coronary artery calcification. So it's like you've got a little smoldering, and insulin resistance comes along and throws petrol on the fire. Does that make sense? You've got the insult and the way the body's dealing with the insult, and then you get insulin resistant, and that inflammatory process that's associated with that is fueling that fire and causing it to be a raging fire that puts you towards a heart attack. Does that make sense? So atherosclerosis is a chronic inflammatory, cardiovascular disease is a chronic inflammatory condition to a large degree. And you want to control the factors that is causing that. One of the greatest risk factors for cardiovascular disease are subtle infections that are subclinical grumbling in the background. I mentioned this at the start of our series. This is really keeps popping up in so many different things. We can often harbor subtle infections in our bodies. Bacteria and viruses can sometimes evade complete immune clearance, and your immune system's constantly flaring up to something that's not completely cleared. That can happen. A normal cholesterol does not necessarily equate to no risk of heart disease. Cholesterol is an issue, but the main issue with cardiovascular disease, I told you that point, we need to do more than just control cholesterol. What is the most important risk factor? Insulin resistance. Insulin resistance, insulin resistance. That's one of those buzzwords you have to remember. 42% of all cardiovascular disease, heart attacks, could be prevented if insulin resistance were properly diagnosed early and managed effectively for the entire lifetime. It's the number one factor, more important than anything else. So you need to know, we've said you need to know what your homocysteine is, and you said you need to know what your hsCRP is, that's the highly sensitive CRP, how much inflammation you have in your body. And then we also need to know what the relationship between your insulin and your glucose is doing, because that's telling us how resistant your tissues are, and telling us how much insulin you have floating around, and how much your cardiovascular risk is as a consequence. Make sense? Everybody with me? You following? Daily exercise dramatically alters all the risk factors for cardiovascular disease, heart disease, and cancer. 30 minutes a day lowered risk of heart attack by 50%. So these are things you can do. These are things you need to be writing down. 30 minutes of moderate cardiovascular exercise lowered risk of heart attack by 50%. That's dramatic. That's dramatic. Prioritize exercise every day. You know, when you get up in the day, you go to the toilet, you drink water. There's certain things you do. Hopefully you brush your teeth. Exercise must become one of those things. And I'm speaking to the speaker as much as to you. It's one of the things we relegate to some sort of optional extra if I have time. If you want to be well, exercise has to be part of your program. Avocados, healthy fats we've spoken about. Healthy fats, avocados and soybeans brought together have anti-inflammatory benefit. There's a class of compounds called the unsaponifiables, they've termed, which are found, I think, in soybeans, which are showing to, having anti-inflammatory benefit. Plant-based chemicals, whole foods in balance and moderation contain chemicals that are not found anywhere else. So that's the important point, that whole foods often contain, we're in an era where we can supplement for anything. We can go to Dischem and pull off anything from the shelf. But actually they've found that getting these substances in the whole foods is having benefits that we can't always get from taking a supplement. And some of these compounds, we don't even know how they work yet. So if you want the best guarantee for your health, plant foods, eat plant foods. There's compounds in there, there's mechanisms we still are yet to discover. So the healthy fats in avos increase the HDL, which is the good cholesterol. It gets rid of bad cholesterol. Extra virgin olive oil increases healthy cholesterol. Healthy fats increase healthy cholesterol. The very same molecules also reverse insulin resistance, correct the elevation in insulin glucose. So don't be afraid to include regularly in your diet olive oil, coconut oil, and avocados. Those fats are going to have favorable effects on your blood lipid profile. Those are tangible things you can do. So if you see someone selling avos on the side of the road, pull over. Buy those things. And we live in Natal. We've got fantastic avos here in Natal. This is a little bit busy. Healthy fats we can find, just to summarize some of them, in nuts, raw nuts, magnesium, fiber, zinc, healthy fats. Walnuts. Walnuts have a very favorable omega-3 content. So walnuts is a very good nut to eat. Especially with breakfast, because it's nice to get protein with every meal, but certainly at breakfast, because it gives you longevity to your glycemic control. Healthy carbs. 50% of us, half of us in this room, are very prone to insulin resistance in our genes. There's certain genes, some of them that spring to mind are the PPA or gamma genes. There's certain genes that predispose us to insulin sensitivity issues. And our lifestyles often determine whether those genes become active and how active they can be, or what impact they have. Cooked, this was an American thing I took it from, so they call it oatmeal for some reason. Oats, cooked oats is great for you. Contains soluble fiber. Soluble fiber is good at helping control your cholesterol levels as well. And remember, cholesterol is not the uniform baddie. Cholesterol can be a baddie in the right setting, but not all cholesterol is bad. Your body needs cholesterol. Flax seeds and chia seeds are high in protein. Olives, coconut flesh, and oil. Coconuts contain a fat called medium-chain triglycerides, which are metabolized slightly different in the body, in the liver. And they're a good fuel source. In fact, if you take some medium-chain triglycerides as remember you should be eating light when you go to bed. But if you have a medium coconut fat as part of your evening meal, that medium-chain triglyceride that you find in coconut oil helps to provide a good fuel source during the night for you to rest well. So I'm not advocating eating big meals, but to include a healthy fat like coconut oil at night, it metabolizes slightly differently in the liver and provides a good fuel source for your brain. Remember, a sleeping brain requires energy. A healthy sleeping brain requires good energy. And the MCTs, as they're called in coconut oil, are one of those things that can provide that. So what's interesting is they're finding that some of these things like coconut oil actually have antifungal and antimicrobial properties. We know that coconut has antifungal properties. And one of the theories which is really interesting is that as I said, we often, as we get on in life, we've picked up subtle infections which are affecting our health risk. And some of the compounds in coconut oil can have protective effects against some of these subtle infections. There's a theory that some of the neurodegenerative conditions, like Parkinson's and Alzheimer's, might be associated with subclinical subtle infections. I'm not saying it is so. I'm saying there's a suggestion that they could be. And some of these healthy oils can have antimicrobial activity against some of these things. We can harbor infections that can have been present for decades. The message we should be getting from all of this is that we don't just get sick. Getting dementia is not just because we're getting old. We don't have to just accept. If we're controlling inflammation, if we're controlling nutrition, if we're controlling oxidative stress, if we're controlling our hormones, if we're controlling our blood sugar, those are the things that cause disease. Does that make sense? Chronic infections. That's why this science makes so much sense to my thinking, is to look at underlying mechanisms. So we've labored this point. 42% of all cardiovascular events can be prevented by controlling our metabolism and levels of insulin in our body. Repetition helps us remember. Meal balancing is important. Exercise. Exercising after you've eaten is a good way to control your blood sugar. So I'm not saying go run the comrades again. I'm saying moderate exercise. One of the worst things, break time, is it? Okay, do you need a break? Let me just finish this slide. One of the worst things we can do is have a big meal, and then go sit down and do nothing, like I said. So what you're doing with that sugar that you've eaten, that energy source that you've eaten that's getting into your bloodstream, that glucose is spiking, depending on what you've had and how what the constituent of your food is. But when you exercise, you go for a walk after you've eaten, you actually minimize that glucose spike. And that glucose spike is one of the things that's damaging your endothelium. So it's good to, once you've had a meal, take the dog and go for a moderate walk and use that glucose. It controls your glucose curve a whole lot better. And that's a practical thing one can do. Let's have a little bit of a break, a brain breather, a stretch, some stretches and exercise, and we'll come back and finish up. Sure, no problem. I'll put it just around the corner. Yeah, I'm not going to stand there and hold it. No. Yeah. Sure, yeah. Sure. Yeah, right.
The plane flying a bit lower tonight.
You think so?
Not over the heads.
I hope not.
Last night, there was a big fly.
No, this is understandable.
I think this is more practical. They can understand Avos.
Yeah. Yeah, thank you. All right, shall we continue? Is everybody back? No. So just to back up a little bit, just to summarize, what we're saying is that the health of your cardiovascular system is very dependent on the health of the inner lining, which is the endothelium. So to mitigate or to limit your risk of cardiovascular disease, you want to look after your endothelium. You want to control those things that are damaging that structure. You want to control your blood pressure, you control your blood sugar spikes. You want to have an antioxidant-rich diet. You want to be exercising. And then secondly, you want to be living a lifestyle that keeps your carbohydrate control under check. You want to be not having an insulin resistance or situation where your insulin goes high. Okay? So, 36%, we said 42% of heart attacks are related to what? Insulin resistance. 36% of heart attacks could be prevented if we properly diagnose and manage blood pressure from early on. High blood pressure doesn't occur because of the absence of BP meds. What are the multiple causes of blood pressure problems? It's been shown that 80% of all essential hypertension is caused by insulin resistance. So what's the message that's coming through here? We need to understand and stop this plague of insulin resistance. And the thing that's giving us insulin resistance is, yes, a combination of our genes, but also our sedentary lifestyle, eating too much refined carbohydrates, not using it, sitting. These things are causing carbohydrate intolerance. And that insulin resistance is what's putting you at cardiovascular risk. And that insulin resistance is causing high blood pressure, which itself is a risk for cardiovascular disease. So, the insulin resistance is increasing your high blood pressure. The high blood pressure is increasing your endothelial insult, which is, accelerating your cardiovascular risk. So it all works hand in hand. And previously we were treating these things as separate things, like we're going to pill for your blood pressure, pill for your insulin resistance. There's underlying mechanisms that are common, and we need to understand that. The first thing we should do is address insulin resistance. Do a glucose tolerance test. Now this is a very valuable test. So we've spoken about homocysteine, we've spoken about highly sensitive CRP. If you want to know the relationship between your insulin and your glucose, a glucose tolerance test is really helpful. The standard one is about a 2-hour test. You're given a sugar bolus at time 0, and then when you've been fasting, and then you test your insulin and your glucose at various times throughout that test. And you test the relationship between your insulin and your glucose. And if you require more and more insulin to get that glucose low, then you are resistant to insulin. No problem. Does that make sense? So a glucose tolerance test, it's not just telling you about your diabetic risk. It tells you about your cancer risk, your blood pressure risk, and all genetic tendencies will be augmented if you're insulin resistant. At least half of people with high blood pressure are insulin resistant. Profound. Other factors that influence BP, how much potassium and magnesium is in your diet. Now, magnesium is a nice relaxing mineral. Magnesium is one of those minerals that many of us are deficient in. And it's a very important balancing mineral. Works in conjunction with calcium. And potassium and magnesium are important in regulating our blood pressure. If we decrease the salt intake in the American diet by a third, we could save 90,000 people per year. But it's not just the salt. It's the salt to potassium ratio. So, whole plant-based foods are rich in potassium. What food comes to mind immediately when you think of potassium? Bananas. Bananas are rich in potassium. So potassium is a nice relaxing, nice mineral that lowers your risk of hypertension. 100% whole grains, legumes, beans, peas, lentils, and greens also gives us the magnesium that we need. Plant-based foods contain potassium, magnesium. Magnesium neutralizes the ability of cholesterol to form a plaque. Interesting. There was a framing and heart study done on vitamin D3. Vitamin D is another very important thing to know. So we've spoken about homocysteine, we've spoken about hsCRP, we've spoken about glucose tolerance test if you want to assess the relationship of your glucose to your insulin. Next really important thing to know about is your vitamin D level. The vitamin D we test is a 25-hydroxy vitamin D level. And they found, listen to this, if your vitamin D level is less than 15, your risk of heart disease goes up twofold. I worked in the UK for quite a while, and in the UK the sun doesn't shine. And I came back from the UK and did my vitamin D level, and it was 18. Optimal vitamin D is 50 to 70 and more. So mine was 18. So if you're constantly indoors, you're not out in the sun, you're at risk of vitamin D deficiency. And it protects against cancer, multiple sclerosis. Breast cancer patients with terminal breast cancer, when they elevated their vitamin D, they dramatically extended their lifespans for twice as long. And what you must get from these slides is that it's a multi-pronged approach. It's not one thing that's going to mitigate your risk. It's not one thing that's going to give you this outcome. We've looked at homocysteine, we've looked at highly sensitive CRPs, we're looking at insulin resistance, we're looking at vitamin D levels. Vitamin D deficiency is one of the most unrecognized cardiovascular risk factors. Screen and treat in everybody. It's easily identified and easily treatable. So don't let somebody die of heart disease, don't let yourself die of heart disease because you're deficient in vitamin D. Simple thing. Low vitamin D causes the imbalance in your kidney, not to balance the renin-angiotensin-aldosterone system. That's a blood pressure regulating system. Family history had the lowest contribution of all the established risk factors for cardiovascular disease. So to say that I'm going to get a heart attack because my dad had one is not true. Not strongly true. Only 4% of heart attacks could be attributed to family history. So what does that say? That's saying a lot of it's lifestyle, isn't it? Which means if we're all dying of cardiovascular disease, we must all be having the same lifestyle. Or many of us are having the same lifestyle. So the important test, GTT, your 2-hour insulin level is one of the most important risk factors for cardiovascular disease, is knowing that relationship. Lipid profile assessments have come a long way. We used to, the way we look at your lipid profile has really graduated to a new level. They're looking at smaller particles, looking at more sophisticated particles. The small and dense particles are more likely to infiltrate your artery wall. So a more detailed cholesterol profile can be often useful in trying to ascertain your cardiovascular risk. But remember, we said that it's not just your blood fats that are going to increase your cardiovascular risk. Yes, they must be in favorable limits, but your insulin sensitivity is having the biggest contribution, the inflammation that's happening on that fatty deposition. Thyroid function can control your cardiovascular risk. In fact, hypothyroidism, underactive thyroid gland, controls creates an unfavorable lipid profile. Foods rich in magnesium, potassium, fiber, and iodine are important. If we have insulin resistance, our risk of heart attack goes up by 300%. That's significant, eh? Significant. Just if we have insulin resistance, our risk of heart attack increases by up to 300%. So, novel biomarkers for cardiovascular disease. This is not to bog you down with details. The way we assess cardiovascular risk has improved dramatically. The guys in Cleveland, this information comes from them. They were doing some research. The classic lipid panel that you all have when you go to your GP is telling you about your long-term cardiovascular risk. So if you have your HDL, your LDL, your triglyceride level, your total cholesterol done, those things are telling you what's your long-term risk of getting cardiovascular disease, which is what you get when you go to your GP or anyone else that's assessing your cardiovascular risk. Things like apolipoprotein B or advanced lipid testing tell you about your mid-term risk in terms of decades. What's your risk in terms of the next few decades like? ApoB, ApoA1, SLDL, lipoprotein A, HDL2B. And near-term risks are really important. They've now found a unique panel of biomarkers that can actually tell you what your imminent risk of heart attack is. Don't you think that'll be useful? If we can measure inflammatory molecules in your blood to say, how at risk is this person of a plaque rupture and subsequent MI or stroke, or heart attack or stroke. So the near-term risk ones are really interesting me to find in terms of years, things like highly sensitive CRP. Atherosclerosis, as I've said, is a chronic inflammatory disease. You're getting this grumbling inflammatory process affecting your blood vessel wall. It's a dynamic process with lifestyle factors determining how it's progressing. Does that make sense? So chronic inflammatory disease. 2-hit strategy. You get the injury to the vessel wall, mostly driven by cholesterol oxidation and cell death, and then you get inflammation. And the bulk of cardiovascular intervention strategies is focused on, as I've said, that injury to the vessel wall. Looking at your blood pressure, looking at your dysglycemia. But now we're looking at the inflammation that's happening on top of all of that. And that's the next phase of cardiovascular intervention and assessment. 50%, as we said, of people that have heart attacks have normal lipid profiles. So it's not just your lipids. 10 minutes. If we really want to improve outcomes, we need to start measuring inflammatory markers. That's the important message. If you really want to know what your cardiovascular risk is like, we need to start looking at how much inflammation is happening. And there's certain compounds, and these are them, and don't worry about the names, but they're out there now. There's a thing called F2-isoprostane, which is a marker of oxidation, which tells you about your long-term risk for cancer and cardiovascular risk. An albumin to creatinine ratio in the urine will tell you about endothelial dysfunction. So how much is your endothelium under strain? Highly sensitive CRPs predicts arterial inflammation. And these two are really interesting, myeloperoxidase and LPPLA2. Anybody heard of these? So myeloperoxidase, if I take your blood and you have elevated myeloperoxidase levels and LPPLA2s, now this is not to make you neurotic, I'm just telling you there's ways of assessing some of these things. If you have elevated levels of these things, it can tell us that you have vulnerable plaque somewhere in your body. So that plaque that's been lining your arteries is vulnerable if these things are elevated. And that's very important information because that now can give us the impetus to really focus on intervention strategies on that category of patient. That yes, they might have a dyslipidemia, but that's telling me more about their long-term risk. But now I've assessed this patient and their myeloperoxidase and LPPLA2 is elevated. That means that they've got unstable plaque somewhere in their body. That means that plaque is highly inflamed, it's highly aggravated, and the next thing in sequence is rupture of that plaque. And that means there's no off noise, since it's an Afrikaans. We've really got to make a massive intervention. Does that make sense? So cardiovascular risk assessment has progressed dramatically, and the new focus is on inflammatory markers, because the inflammatory markers are telling us more about your imminent risk of heart disease and strokes. Make sense? Just to finish off, vitamin K2, we spoke about that. This is an important vitamin. We know about vitamin K1 that's involved in blood clotting. But vitamin K2 is affecting two proteins. The one is in the arterial wall, and the one's a protein called osteocalcin in your bones. So K2 mobilizes that calcium that's sitting in your artery wall where it doesn't belong and gets it into your bones. So you can get vitamin K2 in sort of fermented soy products. Look at some sources of plant foods of vitamin K2. But it's one of those vitamins that's not a bad idea to supplement because many of us will be deficient in vitamin K2. I'm not saying you have to supplement everything. I'm not saying that. We must start with the lifestyle, start with a whole foods plant-based diet, get as many of your nutrients in the plants because isolating compounds is never as good as the whole food. But if you're going to supplement, vitamin K2 is not a bad idea. If you're looking at some of these nutrients that are important that work together, we've always focused on calcium, magnesium. Calcium, magnesium, vitamin D, and vitamin K2 work nicely together. The vitamin D does what? It helps your body to absorb the calcium, right? So you get the calcium into the blood, but now you don't want the calcium to stay in the blood. You want it in the bones or in you're affecting your cells. So you need K2 for that. And it's been suggested that vitamin K2 is one of the missing factors in cardiovascular disease that we haven't focused on early enough. So if you want to mitigate your risk of calcification in your arteries, vitamin K2 is one of the things to optimize. Vitamin D is important to get the calcium up there in the first place. Magnesium is an important balancer against calcium, and a smooth muscle relaxant and controls your blood pressure risk. I just wanted to finish with this next slide, because I think it moves nicely into this, and that's just my opinion. I hope you don't disagree with me. I say unashamedly, and this is to transition, because we're talking about the heart. I say unashamedly, I'm a doctor that believes in a higher power. I believe that we're not accidental beings. I believe that we were made, we were designed. And I have a firm conviction of that. And the heart of the matter in our health, there's a misspelling there. Heart of the matter is the matter of the heart. And we're looking at health and wellness, and we're looking at all this science. But I want to ask you tonight, how's your heart doing? How's your emotions? Because we're talking about the heart and the cardiovascular system. How's your mental state? Do you have peace? Do you have internal quietness? These are important things that I automatically thought about when I was talking about preparing a cardiovascular lecture. This quote always speaks to me, and I just want to leave it with you for your food for thought. Man created for fellowship with God can only in such fellowship find his real life and development. Created to find in God his highest joy, he can find in nothing else that which can quiet the cravings of the heart, can satisfy the longing of the soul. I want you to meditate on that. Just see what you think, and just digest on that a bit and see what you make of it. I'm not trying to force my opinion on you, but I believe that ultimately healing comes from a higher source. And if we really want to be whole and have true health, we need to make this space in our life as well. And I just want to ask you where you're at and say, what space have you made for this part of your life? And have you considered this aspect? Because we can talk science all day for as long as we like, but without this part, we won't be fully whole. I always say that doctors treat disease, God provides healing. So I really feel I would be doing you a disservice if I didn't bring your attention to that, which is why I've added it in. And I believe that, and I hope that somehow you can make it your own. So that brings us to the end of tonight's lecture. I just want to mention on that note, if you're in a situation where you feel you want someone to pray for you, we are offering that. The Project Recovery team can help us with that as well. We're going to have a little box at the back. If you're someone that believes in prayer, that would like us to pray for you, to bring your case before God, if you can leave your name in that box, it'll be at the back of the hall, and we'd be happy to pray for you. So that's the offer we want to extend. Okay. And so that's tonight's lecture. Thank you very much. I hope it was helpful.
Thank you so much, Dr. Bruce.
Sure.
So we are halfway. It's amazing. We've done 4. There's 4 left. Sunday, Monday, Wednesday, Thursday. Don't miss the remaining lectures. They are really valuable. So on your way out, there's a little question box. And we're going to deal with 3 questions now. The first 3 questions we're going to ask Dr. Bruce. And then if you don't get a chance, then you can just jot them down and then he will handle them. So there's question number 1.
Yeah, well, remember that the arteries in your eye are very small arteries, like they are in your kidneys. So many diseases that affect the health of your blood system, your vascular system, will often show up in the small vessels of your body, things like diabetes. So if you're diabetic, particularly, diabetes is what we call a microangiopathy. It affects the very small blood vessels in your body first. So yes, it's strongly indicative of the health of your cardiovascular system. It's not to say there's no disease sitting elsewhere, but it can certainly give you an idea of the health of your vascular system. Absolutely.
Thank you. Number 2?
Your GTT test, you talk about all these tests. Where do we go to have these tests done?
Yeah. And that's an important question. I just want to say that my intention is not to give you an over-predominance of tests or to focus on, but I want to give you some of the tools that can help you look at your risk more comprehensively. So GTT is a standard test that you can do at a lab, like Lancet or Ampath. But in terms of the cardiovascular risk assessment, homocysteine, remember homocysteine, most of the labs will know, but it must be sent on ice to be accurate. You mustn't have a high protein containing meal the night before because that can affect your level. So homocysteine, highly sensitive CRP. A GTT, I wouldn't say everybody rush out and do it if you suspect that you've got insulin resistance. If you're picking up weight, if you can't shed weight, if you've got cardiovascular risk in your family, make sure when any test you do it costs money. So one must make sure you've got the indication for doing the test. I'm telling you what some of these tests are that you can use. So homocysteine, highly sensitive CRP, GTT or glucose tolerance test. Those are three that immediately come to mind in terms of cardiovascular risk assessment. But you can do them at any standard pathology lab like Lancet or Ampath in Natal. they'll know what they are. Yeah. No, you'll have to go through a doctor. But if if you have a chat with your GP and say you want to really try and get on top of your cardiovascular risk and you're trying to be proactive with your cardiovascular health, and can we possibly do these tests? And you can do that.
Thank you.
And again, I'm not saying it's for everybody. I'm saying it must be indicated. That's what I'm saying.
Doctor, my name is Francis Lightfoot. I'm a diabetic, and for the last few years I've had to take warfarin, to thin my blood. Now they say that the reason for this is that I've got a murmur in my heart, and vitamin K creates my blood to thicken.
Yeah.
Now that's dangerous. In fact, I could have a stroke from that. So I have to take warfarin to thin the blood.
Yeah.
And apparently I've got to do this for the rest of my life.
Yeah, that's the whole problem, is that warfarin affects vitamin K1. So it inhibits the enzyme that cycles vitamin K. Vitamin K controls clotting factors. There's different factors in your blood that control whether you clot or not. And those are the ones that vitamin K affects, or warfarin affects, is factors 2, 7, 9, and 10. And so the warfarin's antagonizing vitamin K to decrease your risk of clotting. So one has to be careful with that, because if you take vitamin K now, you can mitigate the effect of the warfarin, which is trying to thin your blood. Does that make sense?
Should I actually do away with vitamin K?
Well, when you take warfarin, they advise that you're cautious about your vitamin K intake for that reason, because the whole reason you're taking warfarin is to thin the blood to a point where your stroke risk is less. So that's a big topic, and we can perhaps talk about that a bit later in a bit more detail. But yes, vitamin K is one of the things that you'd have to be cautious with when you're taking warfarin. But we can talk about it further.
Would that be the only option?
Warfarin. It's not the only option, but one has to, when you're looking at clotting risk, you have to weigh it up in the individual patient, what the condition is. Sometimes we use warfarin in conditions like atrial fibrillation. So the type of the condition that the patient has, their particular situation, should be weighed up to say, well, what sort of risk are they at in terms of stroke type events, and that can give you guidance as to how useful it is to take anticoagulation. But no, warfarin's not the only anticoagulant you can use, but it's one that's traditionally used in the medical model to affect vitamin K function on these clotting hormones, clotting factors. But there are other things that thin the blood as well, things like ginkgo, things that, omega-3s also have a blood thinning effect. But one doesn't want to do that kind of thing outside the supervision of your doctor because of the risk that you're trying to mitigate against. You want to work with someone that has knowledge on that and weigh up your individual risk before you make those kind of decisions, because a stroke is not an event you want to have. So one has to look at individual risk and make an informed decision.
Thank you, Dr. Bruce. If there's more questions, just write them down, put them in the little blue box. There's also the donation box. We told you about that last night. If anybody feels they would like to contribute to help with some of the expenses, it'll be appreciated. And we're looking forward to see you when? Sunday at 18:30. And if you would like to come a little bit earlier for a little chair massage, you're welcome. And as you leave, if you would like to just sit down and relax for a few minutes and have your shoulders rubbed, we'll meet you at the back. Thank you and have a good evening. And thank you, Dr. Bruce.
Thank you.